Down syndrome. Characteristics of exceptional learning needs by Savannah Strobel. An introduction to Down syndrome. Here I included just a short video on how you can see how Down syndrome affects people differently. And it also gives you a realistic view of the challenges that they face every day. What is Down syndrome? Down syndrome is when a person is born with an extra chromosome. It is also known as a chromosomal condition that is associated with intellectual disabilities, facial appearance, and muscle weakness in infants. There are three types of Down syndrome. Trisomy 21, which occurs in 95% of the Down syndrome population. It is when there are 3 copies made of the chromosome 21 instead of the typical 2 copies of chromosome 21. Translocation Down syndrome occurs in 30% of the Down syndrome population. It is an extra part or whole part that is present but is translocated to a different chromosome other than chromosome 21. And last is the mosaic Down syndrome. Mosaic Down syndrome occurs in 2% of the Down syndrome population. Mosaic means a mixture or combination. So some cells may have 3 copies, but other cells may only have the typical 2 copies. People who have mosaic Down syndrome may have fewer features and characteristics than those who have trisomy 21 Down syndrome. Common characteristics of Down syndrome can include a variety of a flattened face, almond-shaped eyes, a short neck, poor muscle tone, shorter in height, and intellectual disabilities. Some may also experience hearing loss, obstructive sleep apnea, frequent ear infections, eye diseases, and heart defects. Not all of those who have Down syndrome have all of the common characteristic. It just depends on the severity of the condition. Some also experience developmental delays, learning disabilities, speech delays, thyroid diseases, bent little fingers, and mouth breathing, and etc. The list goes on and on. A diagnosis of Down syndrome. There's 2 ways to diagnose Down syndrome before the baby is born. The first one is known as a screening test, and the screening test estimates the risk that a fetus has Down syndrome. Examples of a screening test would be an ultrasound or a blood test during the 1st or 2nd trimester of the pregnant woman. The second is a diagnostic test. It tells whether the fetus actually has Down syndrome. A lot of people are scared to take the diagnostic test because it is a higher risk of the fetus being miscarried or having some risk with it. Examples of the diagnostic tests are chronic villus sampling and amniocentesis. Even though the test can predict whether the fetus will have Down syndrome, it cannot predict the full impact of the condition or how severe it may be. The treatment of Down syndrome. There's not really a treatment of Down syndrome. There's nothing that really can change it. The only thing that you can do is make it better. So people suggest to have regular medical checkups. They suggest helping your child develop, watching for early signs of health problems. If you feel like your child is not on the correct growth curve, or they're falling behind on the growth curve or the growth chart, you might want to mention that to your pediatrician and have some testing done. Finding support. That's one of the main things that someone with Down syndrome need, or children of any sort always need support, and they need to be paired with peers who are like them and make them feel comfortable. Another way to help the situation is speech, occupational, and physical therapy. Early intervention with a team of therapists and special educators will also help them in their growth and their education. the impact of Down syndrome. Down syndrome impacts not only the child itself, but the people around them and the society. Down syndrome impacts the child itself intellectually, physically, hearing loss, they have frequent ear infection and heart defects, and like I said earlier, the list goes on. Individuals with Down syndrome are integrated into normal society routines and community organizations. But it is said that students and children with Down syndrome have social understanding that is a strength. They are actually better, they have better understanding of social cues than some people who live a normal life. They are able to pick up on verbal and nonverbal cues. So this is a strength that they possess. Just some extra resources that I found. Brighter Tomorrows is a website that just gives you an insight better to what Down syndrome is and what you can do to help those who have Down syndrome and make them feel comfortable and support them. It also helps parents and gives a lot of resources for them. The second one would be International Mosaic Down Syndrome Association. I really found this to be a neat website just because only 2% of the Down syndrome population have Mosaic Down syndrome. So the Mosaic Down Syndrome Association would be a great way to help those who have the Mosaic Down syndrome find peers and resources and find support, because not many people have that specific type of Down syndrome. So it would be nice, for the people who do to find others like them and for them to find support and support groups. And then the third would be Medline Plus Down syndrome. This is just basically a medical point of view on Down syndrome, and it has a lot of resources for parents and for those who have Down syndrome themselves, and it gives you really just a background of what Down syndrome is. And like I said, it just gives a basic medical point of view on Down syndrome. And then I included the references that I used from the websites. If anyone is interested in learning more about Down syndrome, I would definitely encourage them to do so. There's so much that we don't know about Down syndrome that once you get to further looking into it, you learn a lot more. And I just hope that you found this interesting. Thank you.